Today there are 2 new cases of COVID-19 in managed isolation in New Zealand. There continue to be no cases of COVID-19 in the community. It's been 67 days since the last case of COVID-19 that was acquired locally from an unknown source. Both cases today were returnees who are staying at the Sedema Hotel in Christchurch. The first case is a woman in her 20s, and the second case is a woman in her 30s, and they are both from the same family. They arrived back to New Zealand from Afghanistan on a repatriation flight on July the 2nd. Both tested positive as part of routine testing around day 3 of their stay in managed isolation. That brings our total number of confirmed cases in New Zealand to 1,186. That's the number that the Ministry of Health reports to the World Health Organisation. There is now nobody in New Zealand receiving hospital-level care for COVID-19. The person who was in Auckland City Hospital has been discharged back to the quarantine facility. 2 people are now considered to have recovered from COVID-19, which means that there are 22 active cases of COVID-19 in New Zealand. All of those cases are in managed isolation or quarantine. Yesterday, our laboratories completed 1,641 COVID-19 tests. That brings the total number of tests completed to date to 416,924. I've instructed health officials to ensure that there is an enhanced rate of testing over the next week. In recent days, the number of tests that you will have seen processed in recent days does not meet the government's expectation around the rate of testing that is required. We understand that being in managed isolation can be stressful for people, and we're also aware that people coming back to New Zealand may now have an increased need for support. They may be returning from stressful situations overseas, or they may have had difficulty getting home. People in managed isolation or quarantine have a health and wellbeing assessment on arrival at facilities, which includes questions about their mental health and wellbeing. They're also provided with information on mental health, substance use and abuse, and wellbeing resources, including online therapeutic tools. We'll continue to provide support and adapt the type of support that we provide to meet the mental health and wellbeing needs of the people who are in these facilities. We also recognise that getting home may have been stressful for many people. We recognise the need to show compassion towards the people who are in our facilities, and we recognise that they are all playing their part as our team of 5 million by being in managed isolation or in quarantine.